Hey guys, welcome to this new video. In today's video, we're gonna talk about healthcare and most specifically dental here in Asia. You may have heard emerging countries like Thailand, Vietnam, India that get more and more attractivity worldwide for tourism purpose. So people are traveling in the country to get some specific healthcare. And today I'm very happy to have Albert with me, who is the co-owner, I can say, of a dental clinic here in Ho Chi Minh City, Vietnam, to discuss about this topic. Thank you, Albert, to give you some schedule today to discuss about this topic. Can you maybe start by introducing yourself and your journey in the dental industry?
Hi, thank you for having me on your channel. So my name's Albert. I'm a Vietnamese Australian. So I was born, I grew up in Australia after my parents left Vietnam as refugees. And I grew up, did all my schooling, education in Australia. After school, I decided on a career in dentistry because I wanted to be in healthcare. But then dentistry, because it's a very hands-on, practical side of medical field. And I always love to help people directly. And dentists gets a chance to directly, hands-on, help our patients in need to get them in better. And I've been working for 20 years now. I'm a dentist originally, but I'm also a dental specialist. I'm a periodontist, which I specialize in managing gum disease, surgery, dental implants. So I have a broad range of experience and expertise. So I come back to Vietnam now and set up a clinic, making a bigger impact, bringing my skills back to a developing country like Vietnam to help people here in Vietnam and obviously people abroad that come back here.
Okay, interesting story, Albert. So actually you had the experience of working in Australia as well as in Vietnam. Can you discuss a bit about the main differences you observe in Western countries or Australia and those emerging countries like Asia, especially the one we mentioned earlier?
So I think in the medical field, in the Western countries, they set the standards. So if you're talking international best practice standards, usually it's emerging from the Western countries. Mm-hmm. They have the luxury of established healthcare systems, government investment. And so the healthcare systems in Western countries, North America, Australia, Europe, it's well established and the standards solid and good. Being brought up, trained and worked for many years in Australia and in North America, I'm used to the standards. There's also the level of ethics. So I think ethics is important in healthcare because it governs and dictates how care is developed and delivered, and the standards we have to abide by. And it's interesting when I come back to Vietnam. Vietnam is one example of many other developing countries, but we just take Vietnam as an example. Standards are developing and increasing, not at international level, and sometimes can exceed that. And we can go into more detail later. But the way healthcare is delivered in the dental field, it's very similar, not too different from Western. It's just about accessibility, resources, and expertise of the healthcare professional, which is a big topic to discuss. I've noticed at a country system level, there are differences, between developed Western countries and developing country like Vietnam. But at the lower level, at the clinic, doctor level, the way care is delivered is actually fairly similar. The only difference is the standard or the quality. Mm-hmm. Okay.
So if we want to narrow in Asia, we have well-established countries like Korea, Japan, Singapore, right? Hong Kong maybe also, that has a certain healthcare already there for decades. And then you have upcoming countries. We mentioned them earlier, Vietnam, Thailand, India. What are the major differences that you observe in those countries?
So in the emerging healthcare markets, for example, Vietnam, India, what's changing is clinics, hospitals, they're investing more into facilities, more into upskilling of healthcare professionals, whether it's doctors, support staff, nurses, accessibility to supplies, equipment, materials. It's readily available. It's a matter of choice. So people at a management level, hospitals or private clinics, people know that healthcare, because as emerging developing countries, as the standard of living increases, the population obviously demand better quality of life, better healthcare as they focus more on their own health. So as the health system, they need to meet that demand. So we're seeing more investment at a skills level, at facilities, equipment, technology that's becoming more available to these developing countries as the population naturally expect more and more as quality of life increases.
Okay, there are this trend also of tourism healthcare, right? So people will travel from the West to those emerging countries to get special healthcare. Obviously, mostly it's also cost-wise, right? They will get very good treatment for an affordable rate. What are the major type of healthcare, I could say, in those emerging markets?
Traditionally, people, I think there's two groups. So countries where, for example, developed Western countries or countries where they don't actually have access to the level of care, medical care. So maybe the infrastructure or the system doesn't have that particular special medical or dental service. Okay, so either it's not being able to access the particular treatment, or maybe the cost has prohibited, like it's too high, too expensive. So you've had two groups. I think you can classify those in need, that have a medical condition or problem that need to be fixed, which they can't for some reason, they can't access that at their home country. And there's another group of people where they're actually traveling, like you just mentioned. They're going on vacation to a particular destination and at the same time take advantage, take care of their health in addition to the holiday. I think there's two groups of people.
Okay, and so in types of different healthcare, we can find here like plastic surgery, right? So dental, obviously. What are the other big health industry?
People with particular needs, you're talking complicated, so they need surgery. Surgery may be a joint replacement, organ replacement. Some people with cancer, cancer treatment, dental. Dental problems can range from simple to very complex and become very costly. And there's also now fertility issues, which can be very expensive back in Western countries. And so they're seeking that particular treatment abroad. So cancer, surgery, cosmetic, dental, fertility. I think they're the broad types of medical dental treatment that people will seek.
Okay, yeah, I actually relate to the fertility one. I met a doctor who is Dr. Ho Man Tung, that you may know in Ho Chi Minh City. He's actually observing also this trend of VQ mostly coming back here, and then some of them can be treated and can have those type of care that they cannot get easily in the US or in Western markets. So they come here and then they have access to that. And then comparing to Thailand, I feel that for this specific fertility industry, over there it's really a business. While in Vietnam, you may still have more rules and things may be more regulated. So it's also probably differences that you have in those emerging markets. Some markets may be very business focused, while other ones will be more, as you come back to the ethic, like more doing things carefully, ethically, according to what the patient needs.
Yeah, so I think this is where research is needed. And anyone seeking care, whether it's even back home, when you're seeking a place to trust to get medical dental care, whether it's at hospital, private or public clinic, you need to do your homework, your research, find out about the doctor or the clinic, whether it's overseas or back in your home country. You need to do your homework and find out, get a lot of information, get one opinion, maybe second or third opinion. And then from there, other old customer feedback or word of mouth. So I think it pays to try to get as much information before you make a decision anywhere. I think it's a general advice I give to my patients. You need to go somewhere, of course, for quality care, somewhere where you feel you can trust that they're going to do the right thing, but ethically, it's important, I think.
Due diligence.
And we'll share in more detail what things to consider.
We can jump into that. So, for instance, in the dental tourism industry, I guess you have a lot of people, VQ, right, coming here. What are the major things that they need to watch out, maybe the red flags, and things that they have to be aware that also exist in those emerging markets? So, choosing the right provider, what's the process they have to go through?
If you're thinking about going overseas, let's say medical or dental tourism, then you do your research first. So obviously you go online. Okay, look up, whatever services you need, go on the website, read as much as possible about your different options. And if you're looking at a particular clinic, look at the doctors, look at their history, the experience, the qualifications. Do they have overseas qualifications? From where, which university, how many years experience. Also look at all previous customer feedback to get an idea how the other patients, other customers have felt, and that they share positive, negative experiences. And I think in this day and age with technology, we can access, it's very easy now, like you can go arrange online consults, get information, exchange, get the consultation, the preliminary initial consultation first, and get a feel for the process, how thorough they are, how attentive, and you can trust your gut instinct. Like, okay, they're looking after me. What other services can they provide, conveniences to make things seamless? So it's part of doing your homework. If they have on the website or third-party websites, clinic facilities, photos, is it modern facilities? Do they have the technology? How many cases have they done if you're looking at a particular procedure? Okay, so I think do as much information gathering as possible. And so you want to look at facilities, make sure it's clean, modern, infection control, which means hygiene, standards, disinfection, do they sterilize, what protocols? And I think this you have to see firsthand as well. So do your homework before you fly over, but once you get to the hospital or the clinic, you need to get a tour, check to see the standard of hygiene, is it clean? If you always ask questions. There's nothing wrong with asking questions, and see how they answer. Do they stick by certain international standards when it comes to sterilizing, disinfection, the philosophy? Okay, so I think these are things you should look out for as a standard. Okay, expertise and facilities, so that it's for your own safety and well-being.
Okay, and how does it work for the insurance? Let's say you have an insurance provider overseas, those type of care can be covered, yeah?
Yeah, so you need to contact your insurance, ask a full detail, what's covered, is it covered overseas? Because a lot of policies don't apply to overseas care. So before you consider overseas treatment, see if your local health cover actually covers and how much. And then you can contact the relevant overseas clinic or hospital if they're part of the insurance network, if they're in network or outside the network, and that helps you decide on what level of coverage. But usually, if you're seeking overseas care, usually if you do have health insurance back home, the coverage is usually quite minimal. And so that's the reason you go overseas to find these potential options to save costs. Okay, so the cost savings can be substantial. If you go to these developing country healthcare markets, you save 40%, even up to 50, 60%. Okay, and then you can take into account your travel, hotel, accommodation expenses, and you still come out saving quite a bit. So you definitely look into the insurance, how much cover you get, it helps, but usually it's very quite limited, especially we're talking quite complicated, high cost treatment.
Okay. And so Albert, I want to make a link to Premier Dental. You guys are specialized actually in the high-end or even premium care. Can you talk about your positionment, and then why did you choose to provide services for this type of audience?
So we don't specifically position ourselves for the high-end or the premium dental market. Actually, my philosophy, my mission coming back to Vietnam is offering premium, top quality dental service, make it accessible for everyone. So, which means that we actually offer premium level dental services at a reasonable cost. Because I've come back to Vietnam to try to help as many people as possible, whether they're here in Vietnam or abroad, expats, tourists, or dental tourist patients. We actually obviously attract the high-end premium overseas, the VGILs, quite a lot, because we're spreading that we're offering great care at a very reasonable price. So my team, we pride ourselves on holding that top quality care, which I would be providing whether I'll be back in Australia or in the United States. We've been here for 6 years, and word is spreading that we're offering this great level of care and that a lot of people can afford. I'll give you a quick tour of our clinic here in District 2, Thao Dien. So we have, this is the entry foyer reception area where we greet our patients, do the check-in process and the processing scheduling. And then just come through. Then leads into our sort of lounge waiting area. We've purposely set it out like a waiting room, so not the typical hospital waiting room where it's sterile. This is comfortable like a living room back in home. So we try to keep our patients as comfortable as possible, because going to the dentist is usually quite nerve-wracking,
the best moment
quite
of the day.
stressful. So we try to keep the relaxing ambience just to get everyone more settled before coming for the treatment. So this is the waiting area. And to the side here, this is actually our sterilization room where we process and clean and sterilize all our equipment. And the reason why it's actually here and transparent, because we pride ourselves on best quality process so that our patients, they have the reassurance, they know that how things are processed. This is according to best international standards. So we have all the equipment that you need to guarantee safety for everyone. Okay, so all our equipment, everything is completely clean and sterile. Okay, and then we have to the side here. So this is one. We have 4 dental chairs. This is our first one. So top of the line dental chair. We have a screen monitor for patient education, X-rays. We can explain. Also, we have a TV for patient entertainment, relaxation, distraction, especially for kids and adults, if they prefer. So this is it's designed as I would back in North America or in Australia. Right? So top of the line equipment that we import everything from Europe, and so this is exactly what you'd get at a top clinic back in the Western country. Okay, so this is one example of a dental chair. And this next room, it's our X-ray facilities, and this is again top of the line standard X-ray CT machine that you wouldn't find at many clinics back in the Western country. Okay, so we invested, top of the line. Everything's available. You don't have to go different centers or different location. Everything's all in one location for maximum convenience. So again, everything is clean, top notch. Okay, so process equipment, everything's all on hand. So this next part is the actual surgery room. Okay, for all our surgeries, oral surgery, dental implants. So again, we have the preparation area where the doctor, the medical team will come in, wash, scrub, change into their surgical gear before we step foot. So this is like any hospital. It's the same. It's just a miniaturized version, and this is a surgery room. We have a chair that doubles up for normal dental treatment or convert it into a chair for dental surgery. And again, it's spacious. We have enough room for big cases, sedation, where we have medical anesthetists to come in with their equipment so we can handle all types of surgeries in this room. And we have all the safety, oxygen, medical emergency kit, all on hand, ready to on standby. And we also have a patient recovery room, which a lot of clinics don't have. So after surgery, they need to recover, especially sedation cases. Then we have a recovery room with support staff for our patients. One particular unique feature of our clinic is that we want to be a family-friendly dental center to cater for the whole family, from the kids to the parents to the grandparents. And we have a space here. This is our play area, library for the young kids to come in, and whether they come in before the patient or with their parents doing treatment, they actually have a safe, fun play area for kids. So we want to introduce kids to dental clinic, be non-threatening, so they feel comfortable, they look forward to coming to the dental clinic, and so it works wonders. So kids love coming here, and they have this whole dedicated play area, and we also have a kids activity room for arts and craft. So they come in here, they can do art and craft, painting. We also conduct a lot of school events. We partner up with local schools, do educational field trips and sessions to help kids do free dental checkups, and come in, do dental awareness activities and programs. So we use these facilities quite a lot. And I'll show you one of our kids' treatment rooms. So this is our kids' pediatric treatment room. So it's designed and decorated for kids. So they come in, it's very colourful, smaller dental chair for the smaller kids, so they feel comfortable with the TV on. We have specialists, pediatric dental specialists as well on staff to help take care of the kids at the best possible way, quality and psychologically we can understand the kids so they get the level of care that they deserve. Okay, so this is our kids treatment room that the kids they love, which everyone even come in and feel very very warm and welcoming. Okay, and then we have other chairs as well, but this is a quick tour. We have a lot of space. It's very different from a typical dental clinic because we dedicate a lot of space for the non-clinical treatment because we think it's very important. People come in, feel comfortable. Yeah, it's part of the overall experience, being felt well cared for and have as much as a positive experience going to the dentist rather than just getting quality dental care, which is important. Okay, so it's been a pleasure. We can share this to a lot of people. We welcome people in Vietnam and abroad. If they want to get excellent level of dental care and well looked after for all members of the family, then we welcome them to our clinic.
Thank you, Albert. So I hope you guys had a better understanding about the health care market in Asia and especially the dental market in Vietnam. If you have any question, you can check below and then leave us your questions and we can answer them fast. If you enjoyed the video, leave a thumbs up and then I will put every links below about Albert's clinics and other related information that you may want to check out. Thank you, Albert, again.
Thank you. Thank you. It's a pleasure.
And I see you in the next video. Thank you. Bye-bye.
And I'ma get it right, get on sight like